Trade Union Solidarity's legal challenge to prevent government from implementing the National Health Insurance has failed. The trade union wanted to stop the department from filling 44 vacancies as part of efforts to establish a fully functioning NHI branch, while the legislative process on the bill is underway. Let's get reaction now, and we speak to Foster Mohale, who speaks for the National Department of Health. Mr. Mohale, thank you very much for your time. Let's start with this court victory. What does it mean for the Department of Health?
Good morning, Koli, and good morning to Newzroom Afrika viewers, and thanks for this opportunity. This simply means that the department now has got the green light to continue with the recruitment process to fill these vacancies.
And these are 44 specialists. These are technicians, we understand, or people with technical skills, perhaps I should put it. What exactly is their role in this NHI branch that you say they were meant to go into?
Yeah, in fact, these posts are not only meant for the NHI, but they're meant for broader strengthening of health systems. So this includes the specialists in different fields, from digital, as you know, that we are trying to move from a paper to digital system in order to fast track some of this health system to connect all our health facilities, but also the issue of the procurement of products. As you know, that the NHI is going to involve a lot of procurement of medical products in order to ensure that our people have got access to affordable and quality health services.
Is it the understanding that Solidarity went to court to say you cannot employ these people while the bill is before Parliament? It's not been finalized. Is that the sentiment? And if indeed we have it correct, doesn't that mean that the department is moving ahead or jumping the gun, so to speak?
Yeah, that is the basis of their legal court challenge, that we cannot proceed with this recruitment process while the legislative process is underway in Parliament. But as I indicated earlier on, that these are not only meant for the NHI, but they are meant for broader strengthening of the health system, regardless of whether the NHI is going to proceed or not. So we're still going to advertise this post. Unfortunately, because of the NHI, we have to locate them in the NHI branch, which we are about to establish. So whether the legal legislative process is going to go in our favor or in the favor of those who are against the NHI, these positions are still needed in order to make our health system to be strengthened.
Yeah. So this court ruling, Mr. Mohale, it gives us, members of the public, the opportunity to ask the Department of Health where it is in its efforts to try and have NHI implemented. And I ask you this on the back of the knowledge that you have been running pilot projects. Where are you as a department? How far are you?
Yeah, we are done with the pilot project. We presented the findings, and they proved that through the NHI will be able to render a universal access to quality and affordable healthcare in the country to all South Africans, regardless of their socio-economic status. But also to update about the process of the NHI. Currently, the bill is before Parliament. The Parliamentary Committee on Health is going clause by clause, as part of processing the bill. So later will be followed by the public participation process, where they'll be able to take it to where they'll be able to call different sectors of the economy, of the society, to make their inputs or contributions as part of strengthening this bill. So here, currently, we leave everything into the hands of the parliamentary process, so that they'll be able to do this without the influence of us, the department or the government.
Yeah, there are obvious worries, Foster Mohale. I don't need to remind you of the private sector, which worries that it may lead to them losing business if indeed the NHI does come into being eventually. But in the same breath, you have written in your reaction to this court ruling that 84% of South Africans do not have medical aids, which means that they don't have access to health care. Why should South Africans believe that indeed, once this NHI does come into being, it will cater to them and give them quality health care? And I think that's the point of emphasis, quality health care. Public health system has been on its knees for some time.
Yeah, let me give the example of the way we rolled out the vaccination program in the country, where we try to ensure that all people have got access to vaccines regardless of the deepness of their pockets, and it went well. Whether you got medical aid or not, all people managed to have an access to this life-saving vaccine. So the same way we want to call upon all the sectors of the society, the private healthcare sector, the civil society, your organizations like your Solidarity Union, to say, let them make the inputs on how we can better implement or strengthen this the NHI, because the intention is to ensure that all people have got access to quality and affordable healthcare regardless of the deepness of their pocket. So instead of them worrying about this taking their business away, let them make the inputs on how we can ensure that at the end of the day, the final product is what will resonate with all the people, all the sectors of the society, instead of them dismissing this intervention by the government.
It's a massive project. I don't need to remind you that. That means that lots of money are going to be pumped into this. And South Africans, as we all know, corruption is a major issue in our country. What are the safeguards against corruption?
Yeah, no, definitely. A part of this units that we are going to establish once this bill is passed, we are going to create a number of units like your anti-corruption unit within this National Health Insurance Fund, just like they do in departments like your Home Affairs. They've got an anti-corruption unit within the system. So even in this case, we are going to have a dedicated unit which is going to mainly focus on the anti-corruption activities in order to ensure that all corrupt activities are detected and those who are involved are dealt with without a fear or favor. Cumulatively,
how much are we looking at as a country if indeed we are to implement this successfully?
Look, this is going to be implemented in phases. I may not be able to give you the figure now, but it's going to be implemented in phases. Just like now, it's going to cost us about we've got a budget of 30 million to fill these vacancies, because these are very important vacancies that are going to assist us to establish the system. So once we establish these systems, then we're going to come up with we're going to implement the first phase and to the last phase. But yes, for now, I don't have the final figure, because also the Treasury is going to allocate the budget as we move on.
That's a very interesting point you've just raised there, Mr. Mohale. 13 million rand is budgeted for these 44 posts. How much is each individual entitled to, or at least going to get?
Here, remember, we talk about the specialists that you cannot easily get anyway, because remember, a lot of specialists, they leave public sector, they get poached by private sectors. Others, they also migrate to overseas where they are attracted by a better salary package. So here we are trying to ensure that we recruit the specialists. That's why we said competent technical specialists, so who are going to stay in the system instead of being easily tempted by offers from the private sector or overseas. So here we talk about the senior positions from the chief director up to the deputy director level. So we are trying by all means to avoid any inconveniences where people will be coming and going, which is going to affect the smooth implementation of this project. So we are going to attract very competent technical specialists who we believe that they will be able to sit and stay in the system, so that they assist us as the government to implement this project.
So you're able to break it down into what each individual will likely be paid?
I think that the most senior level is the chief director level, which is about chief director level in government is about 1.2 up to 1.5. But you know that these people, specialists, they don't come cheap. As I indicated earlier, that if we don't recruit the right people to the right positions, then this might also affect the sustainability and also the success of this project.
Foster Mohale, let me thank you very much for your time, sir. He speaks for the National Health Department. To this story now.